In this video, we shall discuss recurrent acute pancreatitis (RAP) in brief. This can be a dreadful condition causing the patient to have multiple attacks of acute pancreatitis. We shall look into the causes, investigations, and treatment. But first, the definition. Any patient who suffers 2 or more attacks of acute pancreatitis is deemed to suffer from recurrent acute pancreatitis. The causes can be broken down into mechanical, metabolic, genetic, autoimmune, and unknown. Let's look into these individually. Before we look into the mechanical causes of recurrent acute pancreatitis, let's look at this cartoon to better understand the anatomy. Here's the liver. The liver has a bile tube coming out of it with a gallbladder attached to the side. The bile tube drains bile into the small bowel. This is the gullet draining into the stomach, which churns the food over and passes it into the small bowel. At the back of the stomach is the gland called the pancreas, which has a tube, the pancreatic duct, which drains enzymes into the small bowel to digest the food. The mechanical causes are thought to cause some degree of obstruction to the pancreatic tube over here, which is thought to be the key event in development of pancreatitis. So let's look into the causes. The commonest cause of pancreatitis is gallstones. The gallstones present within the gallbladder typically fall into the bile tube and then travel downwards. And when they reach the bottom end of the bile tube, they can trigger off pancreatitis because of the proximity to the pancreatic duct. Associated conditions such as biliary sludge or crystals, as well as cholesterol deposits, would have the same effect. Now, the biliary sludge or crystals and the deposits may not be visible on conventional ultrasound scan or even MRI scan. Now, we'll come back to this later. Similarly, any tumors or cancers that cause obstruction of the pancreatic duct would set off pancreatitis. IPMN is a condition of the pancreatic ducts itself, which cause these to get dilated and to be filled up with a mucus-like material, which makes it difficult for the pancreatic juice to flow. Direct trauma to the pancreas can set off pancreatitis. Choledococele is a congenital abnormality of the bile tube, and a specific variant may be low enough to overlay the pancreas and thus increase the risk of pancreatitis. What is a long common channel? Over here you can see the bile tube emptying into the small bowel as well as the pancreatic duct. Typically these two come together for a short distance as shown over here, but if there is a long common channel allowing bile to reflux back into the pancreatic duct as over here, then this is thought to be the mechanism for pancreatitis. Finally, autoimmune pancreatitis of a specific variety, so-called duct-centric, which causes the pancreatic duct to thicken and thus reduce the caliber of the duct, may set off pancreatitis. Lastly, there are 2 developmental conditions of the pancreas that have been associated with pancreatitis, but the exact causal relationship has not been clarified. The first is pancreas divisum, and basically it means that instead of the pancreatic duct following the usual course, giving off a smaller tube and the main tube traversing, in pancreas divisum, the main pancreatic tube is either absent or much smaller, and the normally smaller one is quite big, opening up into the small bowel through a separate entrance. What is the sphincter of Oddi? Let's assume this is the bile tube and this is the pancreas tube, and these have a sphincter around them to regulate the rate at which the pancreatic secretions and bile is emptied, and a dysfunction of this sphincter mechanism is thought to be one of the causative problems for recurrent acute pancreatitis. Further research to prove these theories is required. Of the metabolic causes, alcohol is the most significant. This is associated with 25% of the cases in the Western world. Other factors that may impact the pancreas include high levels of lipids, usually in association with diabetes mellitus, high levels of calcium for whatever cause, and certain types of medication, all affecting the pancreas and triggering pancreatitis. The use of steroids and medication that suppress immunity have particularly been implicated. However, there is a very long list of medication that may set off pancreatitis. It is not a common cause, and all other causes ought to be eliminated before drugs are blamed for an attack of pancreatitis. So what about genetics and what role it plays? When multiple members of the same family develop pancreatitis, a hereditary component that is passed down the generation ought to be suspected. Further, in younger adults, those less than 35, in children and adolescents, an attack of pancreatitis must make one suspicious of presence of specific genes that increase the risk of pancreatitis. Specifically, these three are implicated, but this research is fast-paced and other linkages will soon be found. Further, the presence of these genes increase the risk of pancreatitis due to other causes and play into the other reasons of why patients may develop pancreatitis. So how does one investigate this? The important thing is first to try and find a mechanical cause for the pancreatitis. This will require imaging of the pancreas. Transabdominal ultrasound scan will assess for gallstones. A CT scan will look at the pancreas and assess for mechanical causes such as tumors, IPMN, and other causes. An MRI scan augmented by the use of a hormone secretin, which impacts the pancreatic enzyme passing through the pancreatic duct, is a very useful investigation to assess for anomalies of the pancreatic duct and other genetic variants. One of the important and key investigation is an endoscopic ultrasound, where an endoscope is passed down into the stomach with an ultrasound scan attached to it, taking pictures and scans at very close level while it traverses the stomach and the duodenum, assessing for all possible causes of mechanical pancreatitis, as well as assessing the gallbladder for biliary crystals, sludge, and small stones not seen by other modalities such as an MRI scan. The importance of using endoscopic ultrasound in assessing this condition cannot be underestimated. What about the metabolic causes? A history of alcohol intake must be suspected, and at times patients may not be forthcoming with the amount they drink or whether they drink at all. Patients ought to have their lipid levels checked and their calcium level checked in the blood, which are other possible causes. Finally, in patients in whom all other causes have been excluded, and specifically in the younger age group, a genetic screening would help in understanding the condition, and perhaps as the time goes on, more and more patients for whom previously a cause was not found would finally be thought to be secondary to genetic causes. As pointed out before, it is important to realize that several causes may come together to set off pancreatitis. So how do we treat recurrent acute pancreatitis? It is important to realize that any of these causes can set off several attacks of pancreatitis, and the danger is progression to chronic pancreatitis, where scar tissue is formed within the pancreas and increasing the risk of pancreatic failure and future complications affecting quality of life. And this may include removal of the gallbladder, stopping alcohol, taking medication to control the level of lipids, specifically triglycerides, controlling the level of calcium in the blood, altering medication, and so on. If a cause is not evident, then all known risk factors for pancreatitis ought to be avoided. There isn't enough research at the moment to suggest medication such as antioxidants which may reduce the risk of future pancreatitis. Very small yet inconclusive have studies that pancreatic enzymes may help in certain situations, but further evidence is awaited. In the end, it is important that patients are seen, investigated, and treated in specialist units wherever possible to stop this dreadful condition in its track and prevent future complications and risk to quality of life. This ends this topic. I hope you found this of use. If you have any comments, please do share. Finally, please do review other videos within the playlist to get a fuller picture.